should have some recourse in terms of trying to support themselves and the cost of additional care. Now that being said, we have to make sure that the claim is legitimate. And a few years ago, part of the reform initiative that I helped write really strengthened what we call the affidavit of merit, which would really ensure that any claim that was brought by anyone who was filing it, particularly a victim or proposed victim, that event really had merit, and that it was screened by a panel of physicians that actually understood the process in that particular type of medicine. In the past, for example, a chiropractor would be a witness for cardiac surgery, and so you didn't have an expert that actually understood the dynamic. And so now we require experts that are in the same field of practice to screen those claims. And so we've seen the number of claims come down, we've seen costs come down, but we're trying to reconcile the safety of patients, but also making sure that we have enough doctors that can afford to practice in this state. And I know that every physician I've ever met cares deeply about the physician that they care for. So thank you for your question, I appreciate it.
Thank you. That was Senator Vitale, and we have a lot of questions actually coming in on the phone about health care and getting access to health care insurance, particularly for those who aren't of Medicare age. So I'd like to take a question right now from Elizabeth. Elizabeth, are you on the phone?
Yes, I am.
Do you have your question ready?
Yes, I do.
Go ahead.
To either senator or the congressman, I'm a 56-year-old woman, and I'd just like to ask, what do people in my situation who do not have health care? I had lost a job a couple of years ago due to age discrimination, and I'm working now for the state as a security guard in the school system, but because of all the cuts that Governor Corzine made, I can only work up to 30 hours a week because they don't want to pay for health care. So what do people like me who have no health care, where do you go? Where do you go for this? I mean, I haven't really had, thank God, a whole lot of problems the last couple of years, but I mean, it's frightening.
Well, this is Congressman Pallone, Elizabeth. I think that this is the heart, your example is the heart of the health care reform that we're trying to achieve right now at the federal level in Washington. And I'll try to be brief, although I could talk for hours. Basically, what we're finding is, there are about 47 million Americans that have no health insurance. But there are a lot of other people that have health insurance, particularly if they have to buy it individually, that increasingly can't afford it because of the cost of health insurance in the individual market. So what we're doing now with this health care reform, and the bill should be available within the next few weeks, and we're going to try to move it, is basically say that if you're not eligible for a government program, you're not poor enough for Medicaid, you're not old enough for Medicare, you're not getting insurance through your employer because a lot of them increasingly can't afford it, then what you'll do is you'll try to get insurance through what we call a health marketplace. In other words, the government will tell the private insurers, look, if you give us a reasonable policy at a lower cost, then you can sign up your plan through the government, and people like yourselves would then look for these various private insurance plans through the federal government. But because all the people that now are in the individual market or in small group plans or who have no insurance at all, like you, participate, we figure it'll be a huge, maybe 50, 60 million people that will be getting health insurance through this marketplace, authorized by the government, and that'll bring the costs way down, maybe even half what some people are paying now for an individual policy. And then, if you still can't afford it, you would pay a part of it and the government would subsidize the rest. So you'd essentially be able to go, if this becomes law this year, and we're trying to make it law this year, you'd be able to go to the government, shop for individual policy that hopefully would be reasonable, and you get help paying for it depending upon your income. We're hopeful that this bill will be considered in committee and in the next month or so go to the floor and be signed into law by the President by the end of the year. That's the goal.
Thank you very much. That was Congressman Pallone. I think Senator Vitale might also want to add, in the interim, maybe some options that are available in the state and what's happening on healthcare reform on the state level.
Well, we're fortunate to have recently had great success just early last year in providing additional care for more parents and access to family care and more children as well. Our challenge this year, particularly in this budget year, and everyone who's participating this morning understands how difficult things are, not just in New Jersey but throughout the country, making sure that the programs we already offer to children and some parents remain intact. The existing governor's proposal for this year's budget would freeze enrollment for new enrollees into family care for certain parents. And of course, I've been on record as not supporting that, although the governor's a friend and I support the governor on many of his health initiatives. We have to make sure that the program that's already in place for parents continues to enroll them. These are working parents who go out every day, work for small businesses more than likely, who won't provide health insurance or probably can't because of the cost. And so they're left uninsured. There are opportunities for certain parents to enroll in family care today. And Elizabeth, I don't know if you would be eligible, but I can check for you. I don't know if you're a parent or not, if your children are over the age of 19 or 18 to allow you to be eligible. But there are opportunities. There are also what's called the basic and essential policies in the insurance industry. Those are individual policies that are lower cost, but I don't know how much lower cost means to you and that fits your budget. But again, we can talk offline about that. But there are resources, may not fit your budget, but God willing, Congressman, his proposal and those on the federal level will bear fruit, and we won't have to have this conversation in the future.
Thank you very much. That was Senator Joseph Vitale. And you are joining us, if you're just joining us now, on an AARP live teletown hall with Congressman Frank Pallone and Senator Joseph Vitale, talking about healthcare reform and healthcare reform efforts on both the state and federal level. There have been over almost 5,000 members on this call this morning, and it's been a great conversation. We've been talking a lot about access and cost issues, but now I'd like to change topics a little bit and get into the quality of the care that we're receiving in the state. And in our hospitals. AARP has been working very closely with State Senator Joseph Vitale to pass a landmark bill called HEAL, the Hospital Errors Accountability Law. Senator Vitale, thank you very much for your leadership on this bill. I know it's been a tough fight, and I just was wondering if you might tell our members a little bit about the bill if they haven't heard about it.
Sure, thank you, Patricia, and thank you for your partnership in this. AARP is a respected organization, and they get the attention of legislators, and so it's been great working with you on this. The legislation passed the Senate, full Senate, a couple of months ago. A bill I had written, and again we consulted with AARP and other consumer groups, and passed the Assembly Health Committee just last week. Now the bills are a little bit different, so we have to reconcile the differences. But essentially it does a couple things, and maybe quickly as a backdrop to recognize that we talk about the cost of health care, and there are the unattended costs, the unnecessary costs of health care delivery. And one of those elements is our medical errors, and those are particularly preventable. The Institute of Medicine estimates that nearly 90,000 Americans die every year from medical errors. Many of them are preventable, and we've always said that that's the equivalent of one 757 airline crashing every day. And certainly we wouldn't tolerate that, but for some reason we tolerate or look the other way on these other medical errors. Now the bill that we passed would do a few different things. I think they're important to note. One is that it would require hospitals to report to the state publicly on their website, on their hospital quality report card, a number of errors that take place in every hospital throughout the state, so that consumers and policymakers understand what's happening. And those are the most egregious errors: wrong patient, wrong body part, operating on, leaving a foreign object in someone's body after you've operated on them, like a sponge or a clamp, or even operating on the wrong limb, or removing the wrong limb. Those are the kinds of things we need to know more about, but particularly we shouldn't be paying for those things. Now on the federal level, CMS no longer pays for many of those events. They refuse to pay for those mistakes, but that was exclusive to Medicare. This legislation would extend it to all payers, whether you're paying out of your pocket or you have a commercial policy. Your plan would not have to pay for those mistakes made in that facility. And that only makes sense because at the end of the day, it's all of us pay the premium. So it's our premium dollars